Question number 9. A 67-year-old woman presents to the office for a checkup regarding her chronic hepatitis C. This is important. You have certain 2 or 3 situations associated with chronic hepatitis C which you need to remember. The last question was also similar to this one. Okay. So let's see. But it was not related to hep C, but some other viruses also can present with this similar presentation. She has a past medical surgical history of iodine allergy, diverticular disease, appendectomy, hysterectomy with oophorectomy, umbilical hernioplasty, and the reduction and fixation of ankle fracture. She was diagnosed with chronic hepatitis C 12 years ago. She currently complains of weakness, discoloration of her lower extremities, and muscle and joint pain. Her heart rate is 85 per minute, respiratory rate is 13 per minute, and temperature is 37.3 degrees Celsius, and her blood pressure is 138/85 millimeter mercury. Her laboratory studies show the following: hemoglobin of 16.8, hematocrit of 46.6, platelets of 1,52,000, AST, ALT which are in the normal ranges, alkaline phosphatase of 67, which is again normal range, total protein of 6.9, albumin of 4.2, total bilirubin of 1.1, direct bilirubin of 0.2, indirect of 0.9. So total bilirubin is also normal, albumin is normal, total blood protein is normal, AST, ALT, alk phos, all of this are normal. So LFT is moderately normal, and the HCV RNA quantitative is 1 million copies per ml, which is very high. Which of the following is most likely cause of this patient's symptoms? Regarding chronic hepatitis C. Okay, so here it is given. She has past medical history, iodine allergy. All of this is not much important over here, not pertaining to this question. Diagnosed with chronic hepatitis C 12 years ago. Complaints of weakness, discoloration of her lower extremities, and muscle and joint pain. So this is the key over here: weakness, discoloration of her lower extremities, and muscle and joint pain. Her heart rate is 85, SP, all of this is normal. This shows that her LFTs are normal, within normal range. So now if we were given that her creatinine was very elevated, then we could think of membranous or membranoproliferative glomerulonephritis. But since that is not given, we can, and since when the kidneys are not functioning, you will have a certain level of anemia present, but this hematocrit and hemoglobin are very high, so the patient is sort of healthy, but we have a low platelet count, so that points us more towards mixed cryoglobulinemia syndrome rather than polyarteritis nodosa. In polyarteritis nodosa, we would expect to have painful abdominal pains or melena or something like that, because this is a medium-sized vessel disorder, whereas mixed cryoglobulinemia is a small vessel disorder. And type 1 cryoglobulinemia is something that is intrinsic, so it is not associated with hepatitis B or C. So we'll not see that. So mixed cryoglobulinemia is the answer over here. Remember, whenever they say that the patient is having something like discoloration of lower extremities and it is related to hepatitis C, HIV, relation to HIV is very rare. So the question before this was a rare question, but a very common question that can be asked is that of hepatitis C when it is related to hepatitis C.
Thanks for watching. Please give a thumbs up and subscribe for more.